day 4 at Arab Health here at the M42 main stage. I'm going to encourage you all to please take your seats because we're about to begin our final day here at the exhibition of wonderful programming. We've had 3 full days of panel discussions, fireside chats, and TED Talks, really focusing on that nexus that M42 represents between sustainability, health, and of course, technology. This first panel discussion of the day, I am delighted that I'll have a chance to moderate it. And we're going to do a deep dive into this is a new service that's being unfolded here in the UAE. You may have heard of it as an example of a service that's available elsewhere in the world. But here we're talking about how we can introduce it at a larger scale here in the UAE and across the Middle East. So we're really looking at some real life examples of making this a center of medical services here. This is day case orthopedic surgery, innovations for patients, hospitals, and the environment. I am delighted that joining me on stage here this morning for our very first session of the day here at day 3 at M42 on the main stage. Please do give a big warm welcome to Dr. Hassan Badou, who is the Associate Medical Director for Surgical Services at Mubadala Health Dubai. His colleagues from Mubadala Health Dubai are also joining him. Dr. Asif Ahmed, who is a consultant anaesthetist and head of the department, and Dr. Charles Matthew Oliver, who is also a consultant anaesthetist at Mubadala Health Dubai. We are very fortunate that this organization has taken the time out of their very busy schedule to meet us here today. Dr. Hassan, you of course were on stage with me yesterday, so I'm going to be biased and come to you straight off because I know you can give me a wonderful overview of why do you think we need to focus on this particular area?
To answer this very simply, we're bringing in 21st century medicine to the UAE. Shoulder surgery mostly is becoming outpatient anywhere and everywhere around the world. You don't have the inpatient surgery that you do and the patients would stay overnight. And it's a multifaceted approach. There's a reason why we're taking that to the next level, to bring it to day surgery, and that's what my fellow colleagues will touch upon, and I'll add on it later.
So I think that's quite extraordinary. So first of all, we just need to emphasize that point, that daycare surgery, which might be the norm elsewhere, is still very much limited here in the UAE. And may I say also probably the Middle East region?
Correct. There's cultural barriers, there's regulatory barriers, there's placing and implementing pathways in place that have stopped this from being implemented. But what we're doing at M42 is we're good at pushing the barrier, and that's what we're going to do now.
Fantastic. And Dr. Hassan, you're very good at giving us that overview as well. Now, I had the chance to speak to our illustrious panelists off stage. And Dr. Asif, you gave me a really brilliant insight in terms of, if we just remember back to the pandemic, which we're trying to forget, that sped up the understanding of why daycare surgery would be so important to introduce here. You have your mic.
Yeah, so, I mean, daycare surgery has been with us for the last 20-25 years. But COVID has demonstrated that hospitals are a place where you can catch infections, VT, venous thromboembolism, and other complications. And this has put the day surgery in a new limelight. And there's a big emphasis now on day surgeries. And we have demonstrated in UK and other places like US that if patients go through a perioperative pathway, the complication risks are low and it is very safe. So that's why I think day surgery is now back on the map, and that's why we're talking about it, and especially day case orthopedic surgery. So that's why I think it's really important that we try and implement the pathways for these surgeries.
Fantastic. And if I may bring in Dr. Charles to build on that, the benefits are on the front line.
Thank you. So to pick up on Dr. Asif's comment, so we know that we can reduce complications in patients. So people talk about a value proposition here, where you can improve quality, you can improve patient experience and outcomes, and you can decrease costs, all in the same time. And day case surgery will deliver all of those.
Absolutely. And to build on what you've just said there, Dr. Charles, decrease infections of patients being in hospital for longer. Dr. Asif, I know you were explaining this to me off stage.
Yeah, so there is a organization in the UK called Center for Perioperative Care, and they looked at 27,000 studies all across the world and over 350 systematic articles. And what they found was astonishing. So patients who go through a perioperative pathway, and perioperative pathway does not just mean what we do in theaters. What it means is right from when the patients are seen in the clinic for the first time up to the surgery and discharge and follow up, if there is a set pathway, the risk of surgical complications are reduced by 30 to 80%, right? 30 to 80%. That's a huge margin. And also, there is increased patient satisfaction and increased efficiency. So, as a healthcare provider or any organization, this is the holy triad of healthcare, which is increased efficiency, better patient satisfaction, and better outcomes. So they have demonstrated that, that if we apply these principles, we can achieve really better healthcare, and that's where we should focus on setting patient pathways, and that's what we have been doing at Mubadala Health Dubai, which is a day surgery center where I and my colleagues, we all work. We have been trying to set up perioperative pathways, which Dr. Hassan will talk about a bit later. So we have a perioperative shoulder pathway, and we put patients across those pathways, and we have been successful in doing that.
Thank you very much. And I think you seamlessly have introduced Dr. Hassan. So let's hear a bit more about what Mubadala Health Dubai is at the forefront of providing this service.
Correct, Amandeep. So here's where I want you to take a step back and approach this problem from every single angle. You're a patient, you're a physician, and you're even an insurance carrier. If you're a patient, you want to go into an environment which is extremely friendly, will make you feel at ease, so that a stressful incident in your life becomes a more pleasant journey. This is what the pathways that we have put in place make it for the patient. It adds to the to the decrease in complications, as Asif has touched upon, so it's safer for the patient on the long run. If you're a physician, you can comfortably do those surgeries knowing that, for example, the pathway where the patient positions himself on the table has less complications later, less neck pain. You're going to get less concerns from that patient. It makes you operate as well in a more pleasant environment.
So they're more comfortable because they're only there for the day. Is that
Well,
what
no. The patient is there for the day,
Sure.
but the physician is more comfortable knowing that his patient is traversing through this journey in a safer manner. Being a surgeon, you don't understand how many sleepless nights you get when you have a complication.
But you all
And
look
we all
very
get
good for
them.
your sleepless nights, so
So, but then when you take it from the third facet, and I'm not going to touch on the environment, being a healthcare insurance carrier is where this is going to make a large difference. The costs are much lower, and again, it brings us to the complication rates, safety. Every complication costs the patient, the physician, and the healthcare provider more than 5 times what the regular surgery itself cost us. This is just the monetary cost. We're not talking about the overall value. So when you put all of those factors together, it's a no-brainer that this is the next step in healthcare provision here in the UAE.
I think you're absolutely right. From the audience will agree with me. This does sound like a no-brainer, which begs the question, why has this not been unfolded here as a service and been provided thus far? Who would like to address that in a general way?
Thank you. Great question. So I was just thinking the same thing. It very nicely leads to that. So what we know from hospital, from healthcare, is that it's amazingly complicated. So imagine how different individual patients vary, how you have different teams, different surgeons doing the same procedure. Maybe they do the procedure in different ways. The care on the ward can vary. The fact whether they may or may not develop complications after surgery. So it is a very complicated system, and we know from many years of research that the best way of dealing with this is to protocolize. So checklists, pathways, and other hospitals are doing it. This isn't unique to day surgery, but what
The
we
word that you used there was to postal.
protocolize.
Oh, protocolize.
So
okay.
everything. Some of the audience may be familiar with Atul Gawande's book, The Checklist
Yes.
Manifesto, and he very much spearheaded that with the World Health Organization. So our surgical safety checklist is a really good example of that. So we know the things we need to do, but in the heat of the moment, when you may have had a bad morning, dropping your kids at school, and the patient doesn't react in the way you expect them to, you might forget the timing of the antibiotics, for example. You might forget some of the simple things that we know we have to do. So the thing that's different in day surgery is that these protocols are very tightly defined. So they are done in other hospitals as well, for all sorts of different operations and for medical care as well. I don't want to touch on some of the pathways that we're going to discuss in a minute, but they're very heavily evidence-based. We know that each individual part of the pathway is absolutely essential, but actually more essential is delivering every single part of the pathway together.
I think that's really interesting, and thank you for breaking it down, because as well as us trying to make these conversations very accessible so we're all on the same page, you're right to say it is very complicated. To have at least a little insight into that is really good. I know Dr. Hassan wants to come in now, so please do.
So, just to add on that, every change is faced with resistance. And it's only natural that when you're practically changing the way you're providing healthcare, which is something extremely sensitive, you're going to face that resistance. Okay? A couple of years ago, we were keeping patients for a week. We've been slowly working on reducing that, understanding that it's better for everybody. And this is what we are going to do. We are having a cultural paradigm shift, which is what we plan on doing. Is it going to happen overnight? Of course not. Is this a journey like the journey that we shared yesterday? Of course it will happen. We have the will, we have the means, we do have the capabilities.
Absolutely, and the music actually went to a crescendo. As you said those words, a cultural paradigm shift. I think you're absolutely right to hone in on that word, cultural. And now we have on stage a whole set of international experiences that are being shared here in the UAE. And that really is a secret of the success of the UAE. We have fantastic talent based here with that international collaboration. I'm going to ask you all to maybe share some of the role models that we can look at elsewhere. Dr. Asif, I know that you have illustrious experience back in the UK. Please give us an idea in terms of what we can learn from that model.
So what we have learned is that, to set up a efficient and, highly productive daycare pathway, we need to have the right people. And the right people, starts from the leadership and the management. Unless we have engagement from the management and the leadership, it can't happen. So everyone in the pathway has to be involved. It has to be a multidisciplinary pathway, including the surgeon, the anesthetist, the nurses, the pre-op team. And so that's the right leadership is very, very important for that. We need the right patients, which means that, there is certain inclusion and exclusion criteria. And, we need the right culture, as Dr. Hassan was saying. That's very important. We need patient education. We need to educate them about, how they're going to have their surgery, what it involves. And what we have found, the evidence suggests that if we educate them about their surgery, the outcomes are better, the satisfaction levels are better, the costs are less. So we need the right people, the right pathway, the right culture, and the right patients. And it can be done. Change is always difficult, as Dr. Hassan said, but it can be done.
I think that's really empowering, and it's a very positive mindset to have. Dr. Charles, we were speaking earlier about the USP that Mubadala Health Dubai has. Explore that with us for a moment.
Sure, thank you. So I'm going to touch on what we've been talking about here as well, but really everything at the heart of what we do is quality, high quality care. And I know that there are very well-known hospital brands internationally that do exactly the same, and they have fantastic results. They've dramatically improved outcomes. They reduce hospital stay, they reduce costs. Like I've said, this triad. you can deliver all three at the same time. And so by prioritizing quality and patient experience, that's our USP. There are others internationally, but really here in Dubai, I think that's what we're delivering.
And I believe that the regulation here is particularly strong. So the fact that you do need to reach that high bar of quality is reassuring. And that's possibly a way to show that if you can achieve it, it can be scaled up. Is that the right way to go forward, would you believe?
Absolutely. So it's fairly recent news, but our facility has just got the JCI accreditation, so that's international gold standard for showing quality in healthcare. So we've been recognised in that, and that reflects that it's at the heart of everything we do. Every single member of the facility delivers that, and it's right at the centre, right from the check-in from the patient to when they visit the facility, right through to the assessment by the nurses before they see the doctor, if they come and have the joy of seeing us in an operating theatre. Obviously that's right at the heart of what we do.
And I think that's really exciting to celebrate that. It's only 18 months in working the clinic, but already you're having that high level recognition. You mentioned earlier the word pathways, and I'm going to bring in Dr. Hassan on that and just give us an insight in terms of how the daycare surgery operates.
I'll walk you very briefly through, and this is where I'll talk a little bit faster. I'll walk you very briefly through a single patient's experience on a day surgery. They show up at 8 o'clock, they get dressed, they walk themselves to the operating room. Just imagine how pleasant that experience. You have a bright operating room in there, nice music, relaxing music if you want, you can choose that. And then you sit down. And then that's when we start giving you some medications and you go to sleep. It's typically short surgery, so it's under an hour. Most of the time, you're not even having a tube down, so it's more pleasant waking up. You get a block, so there's no pain. And then you get pamphlets and communications, so that your post-operative care, you have all the education on it. And this is the key. This is what Asif touched upon earlier. The communication with the patient selection is the key paramount to the success of this endeavor. From that point on, the patient will go home comfortable. There's a nurse they can access 24/7. We'll give them a call the following day, check up on them. They would have slept in their own bed. I yet have to remember a single holiday or vacation that I've been on where I'm not coming back on that plane and looking to my wife and say, "Oh, I can't wait to sleep in my own bed tonight." And that's it. We're making that whole experience as pleasant as possible.
And before I bring in Dr. Asif, because I know that you've been patiently waiting, just on that point of the patient being able to sleep in their own bed, this isn't simply an initiative to speed through patients. I mean, there's going to be some surgery where they actually do need to stay overnight. This is actually separating the surgeries where they can be, just to reassure our audience.
Correct.
Here. Yes.
Absolutely. The patient selection before surgery is one of the paramount factors in the success of this project. If you select the right patients, it's successful. Otherwise, there's no point in going down there.
Fantastic. I know that we are fighting against the sound here, but just to say that we are reassured that the patients are selected for this type of surgery in advance. Dr. Asif, you've been waiting very patiently. You're going to speak very loudly as we compete with the other booths.
Thank you. So I think, touching upon what Hassan said, the best bed is the patient's own bed, not the hospital bed. Of course, there will be complex patients who will need inpatient stays, and that's a different, but here we're talking about selecting and being very safe. And at Mubadala Health Dubai, we have a perioperative shoulder pathway. So we put every patient through the same pathway. And this has come from a lot of background work from the UK, where Professor Tim Briggs and his program called GIRFT, which is Getting It Right First Time. And what they found was, if you minimize the variations in healthcare, the outcomes are better. So every patient should go through the same pathway. They have the same education, they get the leaflets, they get the information about their surgery, and minimizing variations in anesthesia, in what we give them, and then we have a post-operative plan. So we give them a pack of medications which they go home. So it's all standardized, and that's very, very important. This is what we want to emphasize. We want to standardize the healthcare. We want to minimize variations. So we have developed this perioperative shoulder pathway, which we implement for patients, and it has been very successful. So patients, it's a mindset as well. So because it's a day surgery center, patient, they know that they are going to be discharged in the same day. So that same message is reinforced right from they come to the clinic until their surgery and discharge. So this is again a really important factor. So if you want to establish a day surgery center in your hospital, the way forward is to isolate it from other areas, in the sense that there should be a dedicated day surgery unit where the patient gets the same message right across, right from their admission to the discharge. And that's the way to a successful day surgery center.
I really appreciate you providing that insight for us there. And I know that you're fighting against the sound, but I think we did get that wonderful message that this needs to be standardized, the patient needs to be reassured, and you could be a model for further services across the
Of
country.
course. So Amandeep, just to add on that, when we're doing surgery, we're taking care of one patient. When you're flying an A380, you have 500 passengers in there, and you have the safety of 500 lives on there, okay? The aviation industry and the healthcare industry have learned from each other on the safety of the journey. We have standardized, just like the aviation industry has standardized all of those protocols. The pilots go through a rigorous checklist every time you get on there. This is it. This is the checklist manifesto that Matthew was talking about. And this is what we want to do for each and every one of our patients.
I really like that metaphor. So we have doctors and pilots on stage with us today. Aren't we a lucky audience? Speaking of a lucky audience, you all look very enthusiastic. I am going to share our doctor stroke pilots with you. Please do indicate if you have a question to them. Fantastic. We have an enthusiastic lady there, the lady who's standing with lots of goodie bags that she's collecting. Good on you. Please take an M42 goodie bag.
Hi, I'm Cristiana Savidu. I'm a hand surgeon in Dubai.
Fantastic. Could you just really high up so we...
Okay, so my question is how feasible it is for a big hospital to have on the side an ambulatory surgery center and try to do most of the elective procedures there in Dubai. I think this is the way to move forward, but other industries, I think they're causing a little bit of problems to us. But as healthcare provider, that's what I prefer. I agree with all of them. It's much better for the patient to come, to do the surgery, to go home, to sleep. They don't even feel they had a big surgery. Yeah.
I think that's a really important question there. Thank you. So how realistic is this?
Yeah, so I think, as I mentioned, to establish a successful day surgery center, you need right people, right pathway, right patients. So right people, there has to be a engagement with the leadership and management. Without that, it's really very difficult. So if they are engaged, the thing is, if we want to achieve the holy triad of efficiency, reduced cost, and better outcomes, we need to, day surgery is cheap, but it's not free. We still need to invest some finances in the day surgery. So that's where the message needs to be driven to the higher management that, as compared to an inpatient stay, the day surgery is much more financially viable and also has better satisfaction. So I think that is the way forward.
Thank you very much, and thank you for engaging. Dr. Charles, I'm going to bring you in on this because I know that this is something you feel very passionate about.
Thank you. So we talked about change. Just because something is always been done in a certain way, this is a very long-term mantra in quality, doesn't mean that you should carry on doing it that way. So you need to innovate. Something we haven't really talked about, Amandeep, is technology, is it? And that was one in the title of our talk. You really nicely introduced one of the things that we're all proud about M42, this intersection between healthcare and healthcare technology. And it does cost money to make these changes, but it pays dividends. So every part of our patient pathway in day case surgery, but it can happen in inpatient surgery as well, we use technology. So right from the app that we've been seeing on the screen behind us, where the patients can upload their details, they can provide investigations, we can communicate with them. The M42 that we have available for our consultations now. In theatre, we're using fairly advanced anaesthetic technology. There's robotics in the surgical side as well. So it's right at the heart of everything we do. After surgery, I know Hassan is a big advocate for this wearable technology. BioPatch, Biointelligence is the company. And what we can do, part of making day case surgery safer, is we can send people home and we can watch their vital signs. We can watch their heart rate, their blood pressure, their body temperature, a whole bunch of other things as well. So we're using technology to really advance and make it safer. And again, quality is right at the heart of what we do.
And I'm really appreciative of you emphasizing that, Dr. Charles. We had so many other points to illuminate here, but you're absolutely right. And in a way, because daycare surgeries is coming late to this region, because really that is the word, technology might be a way for you to actually circumnavigate some of the issues that some of these other legacy countries have had with it, and actually start off right there in a futuristic fashion. So that's really exciting. Dr. Hassan, please elaborate.
Well, this all boils down to advocacy, and that's where the change will come. We have to advocate, but we have to start somewhere. To demonstrate the safety, you have to select the right patient, you have to follow them up, you build your case, and then once you have the case, you will take it forward. This is what we have done. We're here today to present part of this case. It's been a success journey. We've already have a couple of cases under our belt, so that we're not just talking here in the ethos. No, we have successful cases with us, and that's where we will take it to the next step to advocate with the regulators.
And I think, Dr. Hassan, you allow us to maybe have the last few words on that next step. I'm going to build on what Dr. Charles emphasized there. So we've talked about what the problem was, how we can try and resolve it, and let's talk about the how for the future and emphasize that technology point again. You mentioned M42, so Dr. Charles, I'll start with you. A point about the future, but emphasizing technology.
Thank you. So M42 is a very futuristic app that's available to us as clinicians, so we can sit with our patients and we have an AI system. It's a lot like ChatGPT, but it's not out there on the internet. It's an internal secure system. It can access every part of the patient record, their previous letters, investigations, whether they've had surgery, childhood illnesses, family history, the blood tests that they have right here and now, and it can synthesize all of that so we can ask it questions in real time. I played with it, we got it over here, please try it, it's fantastic. So we can have that running while we have the conversation. It gives us more time for that patient interaction.
That's really exciting. I'm going to bring in Dr. Asif and then Dr. Hassan for the last words. The future and the emphasis on technology.
So the future, for day surgery, I think is in UAE, we have to work towards setting up our perioperative pathways, setting up more, places where we can do day surgery. And my final point on day surgery is that it's not only better for patients and healthcare, but also for the environment and sustainability, because we are reducing inpatient stays. So this is another thing to take up to the management and the leadership, is that it's not only better for patients and better for healthcare, but for sustainability as well.
And really emphasizing the nexus of what M42 represents, that cross-section of technology, sustainability, and health.
And that's exactly where we will end it. We're in a very beautiful position, because you have the marriage between a healthcare provider, an AI company. We have the genomics to support as well, the genomics background, and that puts us literally in pole position to drive this forward. Christiana, I'm sure that sooner or later you're going to get what you want. It's just a matter of time. That's what we're going to do.
That's such an empowering and positive message to end on. It's been a delight to hear from you all. I feel like this is merely an introductory talk into this very fascinating session. We're going to have you back at the next session that M42 hosts on this very subject. Ladies and gentlemen, please give a big round of applause to my panelists, Dr. Charles, Dr. Hassan, Dr. Asif. We're going to get a photograph before you all leave the stage. We'll take one seated, because I quite like the seated approach.